Hi, I'm Chanel, one of the journalists at Manx Radio. Welcome to the latest edition of Manx Radio Newscast.
Mr. Raymond Lakeman, yeah.
Do you want to mention anyone's child or anything like that, or just go with Ray Lakeman for now?
Yes, I'm a parent, a bereaved parent. I lost my two sons to an overdose of MDMA, and since I've been working with a charity called Anyone's Child. Parents as people who've been influenced by the drug laws, not necessarily people who died, but have been impacted by the drug laws who want change in the legislation. Right, in November to 2024, Tynwald produced a report which is policies that towards new legislation, the way forward to regarding drug harm limitations, and it's taken nearly 10 years to get to this stage. In 2015, just after my boys had died, they initiated a review into the existing drugs and alcohol strategy, and I was part of that. I asked the then Home Affairs Minister, who was Juan Watterson, and I was part of the discussion groups, and I've watched it evolve over a period of time, and it's taken a long time. 10 years is really, by any standards, quite a long time. But we've eventually ended up with this report that was debated in Tynwald, so it has been published, but so far I haven't seen a lot of acknowledgement of that it's been published, and awareness of any media announcement of it, or public debate about it. So it's something we need to correct it. We need to make it people aware that there is something going on, and I think it's positive.
Now, Ray, I understand you also had a meeting with the Justice Minister. Can you tell us about that?
Yes, I was invited at the beginning of December to talk to Jane Paul Wilson, who's the Minister for Home Affairs. And after the report had been published, I thought it was very, very kind of her to invite me and keep me informed of what was been happening. I was supposed to be talking to one of the MHKs who have been supporting my views for some time, and that was at the end of November, and we couldn't fulfil that date because they were still debating these issues in Tynwald. But it's all been finished. I say it's all been finished. They've done the report, and we have to wait and see the recommendations, the suggestions that they're making are followed through. So I'll be keeping my eye on that, and I would like an update, and I've made that clear to the Minister as things are changing or being debated and being discussed. I'd like to be informed.
What are some of the key factors that you're keen on, or what changes would you like to be seen, made, and how soon?
Right. Well, I think that we have an issue that far too much. We've got too much concentration on criminalising, and I think the people that I'm working with and the people that we see it as more of a health issue than a criminal things, and we think any move that treats it as such more of a health issue than a criminal issue, it is the way forward. And that seems to be the thoughts of Tynwald as well. So that is positive. So that there are a number of measures that they are taking, leaning towards a more health approach rather than criminal activity. The report makes it quite clear that they're aware the harms that the criminal records bring to young people. People are getting dragged into criminality who, for no fault of their own, really. It is the way that the criminal gangs operate. It's and the law as it stands, and the way that we ask the police to act, they're just acting on what the law is. So when they're prosecuting people, they're just doing what they've been told to do. So if we have another approach that leads away from that, I think it'll be beneficial.
Ray, in December 2023, you facilitated a meeting on the island with Anyone's Child, which is a UK organisation. And I know at the time you spoke about, decriminalising drugs, getting it so it's more safer and giving support to people or those taking it. And you also said that by doing this, it deters what's the word? Sorry, it your drug gangs. It breaks them down. What's the word?
Well,
what's the word? It breaks down the drug element. The important.
It will limit their power and their authority. At the moment, because we've operated a system where we just prohibit all kinds of drugs. Automatically, the supply is in the hands of drug gangs and the subsequent dealers. And they're very, very good at supplying meeting the market. We have to accept, and I think Tynwald are accepting as well, that regardless of what we like, we all know the dangers, people are going to take drugs. I don't like it, but I'm being pragmatic here. We have to take a pragmatic approach. We know that what we're doing isn't working. Statistically, the range of drugs is going up. Gangs are getting more violent, which the police acknowledge. The range of drugs is getting wider.
Also preying on the vulnerable.
And they are preying on the vulnerable to distribute and they're very good at doing it. They're getting young people to sell the drugs, to supply the drugs, knowing that they're going to get them into trouble at some point. They get caught at some point. They're disposable, the young people, and there's also the fact that because they're young, they're less likely to be prosecuted. And our system encourages that; they allow it. So I really think that any steps that we can do, to mitigate that, should be taken. And if that means decriminalising, then we should. That's the steps that we should take. We haven't got that far yet. We're not going that far, but there are other things that we can do, and Tynwald are willing to do and willing to see. So I'm not over thrilled. I don't think it's going far enough, but I think it's a step in the right direction, and it is I think it will benefit everybody, because if people start seeing it as being a health issue rather than a criminal issue, that's a huge step in breaking down the stigma about drug use and availability.
I know you say it's a step in the right direction. Does it also show that we as the island or Tynwald, the word's not maturing or getting more modern, but it's you're changing with the times. I mean, earlier we were talking about the festivals and how people are looking to make festivals more safer for festival goers.
Well, again, it comes down to it's accepting people are going to take drugs, and you know, as if we accept that, and we have to because it's a fact, we need to make it safer. We make every aspect of our lives safer. There's health and safety issues covering everything, every aspect of our lives. You know, people take drugs. People don't accept they do. Right, you just brought me a cup of coffee. That's a drug. You have to accept it. I know people who can't begin work in the morning unless they've had 2 or 3 cups of strong coffee. Sugar is a drug. We've got an obesity crisis. It's mainly because people are addicted to fat and sugar. And we accept these things, but we advise people that there's we put into place regulations. We tell people that these things are not healthy, but we don't ban them. The only thing that we ban are drugs, and it doesn't work because if it did work, it would have worked by now. We've had the Misuse of the Drugs Act since 1971, and the situation's worse now than when it was introduced. Automatically overnight, people weren't able to get drugs that they could get before. That happened literally overnight. So the dealers, criminals saw the market and they've exploited it brilliantly.
It's a worldwide operation.
Yeah, it's a worldwide operation. It's never existed before. We signed up to this United Nations Convention. It's a huge problem. And we've opened the door to it. It's too late to close the door now. Because people realise that they like some of these substances. So we have to do something. We have to do something different. What I'm suggesting is what I really like is considered to be radical, but it was the only way to take the power from the gangs. It'll never stop it. There'll still be a black market. There'll still be gangs, but the money that could be generated by taxing these things can go into health, education. They're doing it in the States. A lot of the states are doing it. They've opened hospitals. They've got more hospitals. They can afford the staff, because they're raising, billions in revenue. And we still say no. The Home Office, won't even discuss it. The British Home Office don't even discuss it. Every time I've done a comment on radio or TV across, I get the Home Office spokesman comes on and says this government has no intention of doing it. They've been doing it for 10 years. They've been doing it for longer than 10 years. Successive governments, they all say the same thing. And it's wrong. They know it's wrong. They know it's not working. They can see the statistics. They compile the statistics every year. It's obvious from the statistics that it's not working, and they still carry on doing the same thing.
If I can ask, and I know this also applies to you because you have been affected, but what about others who've been affected, who'd be listening to this interview, who may have also lost loved ones, thinking, I know the pain it's put me through, thinking the opposite of you. Does that make sense? What's your message?
I do know, and I know lots of people who've lost children on the island. Through drugs or one thing or another. A lot of them think that the laws are right. That if if you could prevent the drugs, ban the drugs, arrest the dealers, and this, that, and the other, their child would be alive. But there's no evidence for that. You know.
As a parent, sorry, I'm cutting you off, but as a parent yourself, it's not easy. I'm sure at first it wasn't easy for you to say, because you still have to deal with your reality.
Yeah, yeah.
So for you to actually take a stand and say, actually, let's try something different, it's quite big.
So I was on Good Morning Britain one morning, and I was pointed my point of view, which I made clear, and another parent was on there who'd lost a child, who thought that we weren't being tough enough. You know, and that would help. That would have helped. It would have saved her child and this, that, and the other. But I can't see the logic in that. Because there's no way that you can stop every single drug from getting in and being distributed. It's impossible to do it. And all we can do is, you know, is to restrict, educate and restrict the harm. My boys died of an MDMA overdose. And I know that they died because they didn't know the strength and the purity of, you know, what they were taking. Because it was a powder, didn't say on the list this is enough for 20 doses, don't use it all in one go. Didn't do things like that. They asked for something, they were sold it. And there had no details in it, there's no information on it. And the one thing that I find very hard to understand, because we never really talked about it, I don't know why my boys took drugs, because I knew Jack was taking them. I knew that, you know, he was dabbling. I knew he was taking. But I did the same when I was his age. I dabbled a bit. You know, most people, if they're honest with themselves, may have tried something. You know, it wasn't for me. But I can understand why he would be. He might want to try. And you know, it's the education. But we never really talked about. And Sorin was the one who bought it on the dark web, and he went through a lot of trouble. He researched it on the dark web. He found out what he thought he wanted to get, you know, and I have to accept, whether I like it or not, that it was something he wanted to do. And I never discussed it with him because I didn't realise. I had no reason to know that he was thinking that way. And I've learned that, you know, he was doing something that he wanted to do. He was resourcing it from somewhere that he could. And the only way that he could have been protected was if he'd known exactly what it was that he was taking. You know, and that's a really painful thing to have to come to understand. You know, but I do believe that, you know, he didn't intend to kill himself. He just wanted to enjoy himself, get high or whatever it is.
And he probably thought, but he probably thought, I'm with my older brother. If anything, you know, he's there for me.
Yeah.
You wouldn't think, I'm going to take this and this is going to happen. You wouldn't do that with that intention.
Yeah. And of course, you know, the other thing is that, you know, people are totally underestimating or never reporting the amount of use, how ubiquitous these drugs are. I mean, they actually arrested the chap who supplied them. They found out, they discovered who he was. He was importing MDMA from Holland in jigsaw puzzle boxes. So he was importing jigsaw puzzles, and he was based in Portsmouth, and he was South African, and him and his father were importing it. and they were setting it up on the dark web. Anyway, the police just discovered this by just routine policing. They intercepted this package, so they went to arrest them, and they found the phones and everything like that, and that's how they connected the dealing with Jacques and Torin. They found out that Torin was one of the people who purchased. But they had about 7 or 8 bank accounts, these people, and in one bank account they had over £300,000. So they had 6 other bank accounts or something like that, which it was all done in Bitcoin and stuff like that. So it was untraceable. And so, but if you think about, I think this dealer, he was 21, so he must have been dealing for some years, and you can get. I checked out. You could get MDMA tablets. You get about 50 for £100. All right, so and people could, and then people buy them, and so they cost about £2 each, and so they're selling them on for £10. But if you're selling, if you've got £300,000, that's and it's £100 for 50 pills. That's a hell of a lot of pills that you sold, and that's just one bank account, and that's just one dealer. And the numbers are frightening. So, really, the number of deaths you get from MDMA or stuff like that are very, very small. But they could be none. They could be nothing. They only exist because MDMA is illegal.
So you say education. Education is the key.
Yeah.
And education and understanding.
Yeah, and I think with education, we're not just talking about young people. We're talking about the general public who need educating about the dangers, because they lap up everything that or don't read enough, don't know enough about it. MPs, people in authority, are the same. This is a really serious problem. It's one of the major problems that we have in our society, and we don't know enough about it. I read a lot about it. I'm in contact with a lot of people, and I read differing opinions about it. But I made a point of learning about it because it's important. Not just to say I don't like it, I don't believe in it, the laws are right, find out about it. If these things can be made safe, why aren't we making it safe? Because by not making it safe, we are endangering our young people, and encouraging the criminality. And we should be looking at this. What have we been doing? What we've been allowed to happen? It's no good having taken the moral high ground, or thinking you've got the moral high ground and saying this is wrong, it should be banned, which is a lot of people's reaction. And some people, you would have thought that thou shalt not take drugs was one of the 10 commandments. We didn't have this issue until the 1961, 1970, when we banned it. It wasn't a problem that we've got now. We had a method of dealing with it previously, which we've abandoned, and this is not a centuries old argument that drugs are bad. It's a modern one.
I think I've got everything I need. Do you want to add anything, say anything, mention anything we perhaps didn't?
No. I think I've said it. I mean, I've said it so many times, you know. But I'm really, what I will say is, I when I talked to a couple of MHKs this week, and we were discussing what Tynwald are proposing, and they said that the most of the Tynwald are supportive of these new proposals, which I think is a good thing. So, and the other thing is that the proposals as they are, looking at a harm reduction and proposal and the a move away from criminalising users. There are approaches that we can make, and they are planning to make, implement about prosecutions and working things like that. Are far advanced of anything that the UK are doing at the moment. So we're not doing what I really would like. We're a long way from doing that, but we're moving in the right direction. You know, we have recognised that there's a problem. We've recognised that what we're doing isn't working, and they're trying to do within the restrictions, because we got the restrictions of the United Nations Convention that we're signed up to, the UK have signed up to on our behalf. So we're limited to what we can do, because the UK government have to approve certain things. But there are things that we can do, and it looks as though Tynwald are planning to do it. So I just think we just need to keep an eye on it, and make sure that they you know, what these policies are, what they've listed, they're following through on it.
Thank you for making it to the end of the Manx Radio Newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.